It was with this background where we have individuals of Sjogren's disease who suffer from symptoms related to dry eye and those who do not have symptoms related to dry eye, that we realized there was a need to bridge this disconnect between the dry eye specialists and you who suffer from Sjogren's disease, whom we refer to as Sjogren's disease warriors, that there was a need for us to bridge this disconnect and bring to you the awareness that dry eye is a significant aspect of Sjogren's disease and needs to be addressed. We do understand this gap, which is the reason why we decided to have this webinar as a joint association between Code Eye Care and Institute of Excellence for Cornea, Ocular Surface and Dry Eye and Sjogren's India. Why this webinar for dry eye and Sjogren's disease? Because of the lack of awareness, sometimes an unrecognized association that dry eye could be related to Sjogren's disease. The dry eye in Sjogren's disease could be asymptomatic or silent, leading to late diagnosis, and the importance to understand that early detection helps to prevent vision-threatening complications. Of course,
a very good morning to everyone. It's been such a pleasure to be a part of this very important webinar, especially from the point of view of patients. So 94% of the 209 people reported having dry eye problem, with 59%, as you can see, having severe, moderate to very severe dry eyes. And yet, it's like, only the wearer knows where the shoe pinches. So a person with dry eyes will be able to appreciate that these smallest of things, like, not being able to withstand the wind from the fan, or not being able to drive, not being able to open your eyes without putting eye drops when you wake up at night. These things that we take for granted, this is what we as dry eye patients suffer every single waking hour of our day. What got from the patients was that 27% managed this by limiting their screen time. 16 people reduced the number of working hours, so they had to change their way of working. Some people had to change their job or change the nature of their work. And 10 people out of this 60, and this is only, like I said, indicative. I mean, if you actually did a large survey, we would get enormously large numbers of people whose work life has been impacted by Sjogren's. So it is a serious problem, and I'd like to point that out as a patient and as a patient advocate. So we really need more focus on rheumatology as general, and Sjogren's also as a form of disability. With that, I'd like to end. So thank you very much for this opportunity to talk about the patient's point of view. And I leave you with some of the ways in which you can connect with us.
By the time the patient actually reaches you with multiple health problems, the eyes are completely dry and the patient can barely look at you in the room light, forget the sunlight. Kirtida is talking about the sunlight. That's the bright light that's there even in my cabin today. Patients cannot even sit because my examination cot faces the window. Most times I have to lower the curtains. And these people, when they come to you, as Kirtida so appropriately pointed out, that their problem is they want relief. The way I see it is, the simplest part for me is to focus on the eyes. Because there's an old cliche saying in English that the eyes are mirror to the soul. But actually, the eyes are the mirror to the Sjogren syndrome. This is an evolving disease. Since a lot of patients don't get diagnosed till very late, they come to the rheumatologist and the ophthalmologist extremely late, by which time the eyes are very dry. But the important part that I would look at is what worked for you, because one size does not fit all in Sjogren's. But what is it that is going to help me to stop the disease from progressing? And that's where the opthal perspective comes in. That's where the eye perspective comes in. I only have two parameters here, which are, so we sent a wheelchair bound patient to Geetha 2 weeks ago. I think, was it 2 weeks ago? Yes. And it was 2 weeks ago. She was wheelchair bound. And so currently, as far as Sjogren syndrome is concerned, treatment has to be dependent on other variables as well and deliver customized care depending on your requirement. Thank you very much.
What is this dryness that we are referring to? Here we are talking about the water component of the tear film, which is referred to as aqueous tear deficiency. It is the water component that comes in through the lacrimal glands, and that is what gets damaged in Sjogren's disease. But we know that the tear film is made up of not just water component, but it has oil component, it has a mucus component. It is all mixed together on the eye. I mean, the most common symptoms with which we see people coming to us is, mostly discharge, which gets accumulated on the inner side of the nose, which is quite embarrassing when you are in a social, surrounding. There is, it looks bad. It needs to be cleaned frequently. There's discharge that moves around the eye, and that disturbs your vision. It causes discomfort. There's reduced emotional tearing. People say, I want to cry, but there is no tear that comes out of the eye. And the others in the family feel that, I cannot even emote, or I don't have emotions for a particular situation. Difficulty in seeing bright lights, foreign body sensation, and red eye. Those who are symptomatic, we know what the obvious symptoms are. So what is the effect of these symptoms? A silent dry eye largely looks normal. So others find it very difficult to understand what you are constantly complaining about. You are constantly reminded that there is an eye, that there are eyes in your face. Normally, we don't even think that there are eyes, but those who have dryness are constantly reminded about this, a feeling of tiredness, which impacts productivity at work. And like Kirtida rightly mentioned, the psychosocial economic impact of dryness is large and largely unaddressed, and it ends up impacting the overall quality of life. So once we understand what is happening on the eye with respect to dry eye, we now clearly understand that not one size fits all. Or do we do it in sync? So all that depends on what the status of the eye is. Even the treatment for one eye versus the other might be different based on what your problems are. We need to address the contributing factors, the confounding factors. There are conditions which can appear like dry eye but are not dry. So you may be having those also which need to be addressed. And then we decide how to escalate it to the next level. We spoke about pilocarpine, we spoke about autologous serum tears, again, a couple of points which I will discuss during the panel discussion. And so, what do we recommend as far as dry eye is concerned for Sjogren's disease? At the time of diagnosis, we definitely need to do a dry eye screening every 6 months if there is no or mild dryness. But if there is documented aqueous tear deficiency, just like you meet your rheumatologist once every 4 months, you have to meet the dry eye specialist also once every 4 months in case of dryness. And to sum up, I think we need to understand that all of us have to be aware that dryness is an integral part of Sjogren's disease. Mandatory dry eye screening needs to be done for those who are diagnosed with this condition. And you need a regular follow-up to know what and how the progress of the condition is. At Code Eye Care, of course, our mantra is decoding diagnosis and encoding management. And I just wanted to finish by saying that every journey through chronic illness is unique, but within each challenge lies the possibility of hope. While we cannot always take away all the pain, together we can find comfort and strength in the care that is tailored just for you. Dr. Bhaskar, I can just ask you to elaborate a little bit on the choice of lubricants in those who suffer from dry eye.
Yeah, thanks, Geetha. So basically, when you're looking at the severity of the dry eye, when we evaluate a patient, we basically try to see whether the water component is significantly less, which is primarily the case as far as Sjogren syndrome is concerned. But we would also want to look at whether the oil component is less, and we would ask them to see if it reduces the number of times that they need to use, because the idea is to use drops as minimally as possible so that their quality of life is better preserved. So if you're using preservatives and now a few preservative-free formulations, given a choice, given cost considerations were not there, I would probably choose a preservative-free formulation for all patients. And there, the ophthalmologist will have to then take a call on how he would want to escalate the treatment algorithm, whether he would want to go into an immunomodulator form of treatment with respect to cyclosporin, or he would go on to the next level with respect to either a punctal occlusion or scleral contact lens once he addresses the initial episode of inflammation.
All of us have to have patience, look at the other options that are available. I think one of the most important learning is that probably we need to be aware that there are dry eye specialist ophthalmologists. And that is the first step that we need to take into consideration, maybe consult a dry.
I think we don't have none of the treatment options are the be all end all for dry eye. So I think any treatment option is only after a meticulously thought over and investigated process. It is nothing works for everybody at the same time. What works for one might not work for the other, because of what we have understood and what we have tried to take you through today is that there are several factors that have a role to play, and each one of them needs to be addressed. And as we close, I would like to extend my heartfelt gratitude on behalf of Kodak Care and Sjogren's India.